Good evening, all. You're welcome to today's class on our Npce review. So today we take a look at primary health care, PHC. Today's date is 2nd December 2025. So as usual, I'll write a question on the board, then we'll look at the question. All right, the question 1 says, which item is not considered a component of primary health care? Option A says oral dental health. Option B says supply of essential medicines. Option C says promotion of adequate food supply and nutrition. Option D says community medicine. All right, that's the question on the board. Option A, the question says question 1, which item is not considered a component of primary health care? A, oral dental health. A, oral dental health. B, supply of essential medicines. C, promotion of adequate food supply and nutrition. D, community medicine. The answer to this question is B, community medicine, because I want us to point out the one that is not, please watch, not considered a primary component of what? Considered a component of primary health care. Why is D the answer? This answer is because community medicine on its own is not part of primary health care. It's not a core part of primary health care. Community medicine is an academic or clinical discipline. It's a field. It's a field of medical work practice and education. So it's not a discrete component of what? Or service found under primary health care. So now, basically, primary health care comprises of things like health promotion by talking about nutrition, hygiene. It also encompasses disease prevention and provision of essential medicines and maternal and child health and basic curative services, even oral and dental health. So these are what we found, you can see under primary health care, not community medicine, because community medicine is a discipline on its own. So it's not a component of primary health care. So that is why D is the answer. For others, Oral health, I have mentioned it. Oral health is oral health services, dental, talking about basic dental care, prevention, and what have you. They are commonly found under primary health care. Then provision of supply of essential medicine. Because oral dental health is found under primary health care, that's why it's not the answer. Because the answer to the question says not. Then supply of essential medicine. Supply of essential medicine is part of core component of what primary health care. So that one is not the answer because the question says not. C says promotion of adequate food supply and nutrition. Yes, I mentioned I've talked about health promotion in the area of food, good nutrition, hygiene, and what have you. They are component of primary health care because if you eat well, can prevent disease. So promoting adequate food supply. If there's no adequate food supply, there will be no good nutrition. So two of them work hand in hand. So that's why it's not the answer. Because the question says not. Okay. Let's go to the second question. Okay, the second question says, which definition best describes health? Question 2. Which definition best describes health? A, absence of, let me study so I can economize the goal. A, absence of disease. B, a state of complete physical, mental, and social well-being. C, being bedridden or unable to function. D, not needing to visit hospital often. All right. All right, let's look at the question again. The question says, which definition best describes health? A, absence of disease. B, a state of complete physical, mental, and social well-being. C, being bedridden or unable to function. D, not needing to visit hospital often. Not needing to visit hospital often. So what's the answer to this question? What is the answer to this question? Okay. The answer to this question is B, a state of complete physical, mental, and social well-being. That's the answer. Why did I choose this answer? because this thing aligns with the World Health definition of what health. World Health what definition of what health, and this definition is the most comprehensive of health definitions. So that's why it's adopted. So it says that health, but according to this definition, health is not merely absence of what disease, but a complete state of well-being, physically, mentally, and socially. So that's why B is the answer. Let's look at the other options, why, and stay and discuss why they're not the answer. Option A says absence of disease. No, it's not the answer. Why? Because it's somehow narrow. It's somehow narrow because someone could be may not have any disease, could be disease free. At the same time, the person may lack mental or social well-being. Yes, the person may be mentally not sound or socially not balanced, emotionally down, but the person may not even have any physical ailment, no disease free, but socially and mentally the person and or mentally the person is not balanced. So it's possible. So that's why this A is not the answer. Option B is okay. Option B is the answer. Option C says being bedridden or unable to function. This one doesn't make sense now because being bedridden or unable to function is a typical example of what state of poor health. It's a state of what poor health, poor physical health. So it's not a definition of what health. So it's not the answer. C is not the answer. D says not needing to visit hospital often. Eh? Not needing to visit hospital often. This is not the answer because if you like, go to hospital 20 times in a day, it doesn't matter. So your frequent visit to the hospital have no business with what? With you being healthy. Because many people that are still healthy still visit hospital for prevention. There are people that go there for prevention and just for routine checkup. That doesn't also necessarily mean that they are sick already. So that's you are healthy does not mean that you don't need to go to visit hospital because people still go to hospital even when they are healthy. And it's not even a definition of health in the first place. So this is not the answer. Or if you're not careful, you may pick this answer if you're not careful. So this is not the answer. So the answer to question number 2 is what? B. That health is a state of complete physical, mental, and social well-being. And addendum, not a mere absence of what? Disease, according to what? WHO. All right. So let me clean so we can look at the third question for today. Question 3. Question 3 says primary health care is founded on the following approaches, except A. Traditional methods. B. Scientific methods. C. Socially acceptable approaches. D. Appropriate technology. Question ethic says primary health care is founded on the following approaches, except A. Traditional methods, B. Scientific methods, C. Socially acceptable approaches, D. Appropriate technology. So, what is the answer to this question? The answer to this question is A. Traditional methods. So, why A? Why A? Now, there are approaches to primary health care. So primary health care is actually founded on all the other approaches, with the exception of what? Traditional methods. Yes. Because in as much as yes, primary health care maintains, respect traditional beliefs of the community, but it's not built on that. So that traditional belief doesn't make it form the foundation upon which it's built. But it can respect culture, respect beliefs, but it's not the foundation. So it's not based on traditional belief because most traditional methods are non-scientific. They are non-scientific, they are not empirical, they are not evidence-based, they're just based on just belief. So a primary health care, such cannot form foundation for primary health care because you're talking about people's health now. It's not based on what you believe or feel. So that's why traditional. You remember it says the question says except. That's why traditional method is the answer because it's not built on the traditional methods. Primary health care is based on scientific best practices. And it must be what? Socially acceptable, as I said. That's where the traditional belief come in a bit, but it's not built on it because it should work socially acceptable. So it should fit into the local culture, the community. And it must have appropriate make use of it, and it also make use of appropriate what? Technology. And this technology should be simple, affordable, and sustainable. If it's not simple, if it's not affordable, if it's not sustainable, then it's far beyond primary health care because it must be accessible to the people. So in all, primary health care approaches is scientific, so it's not based on traditional methods.